But welcome to the College of Nursing. Welcome to this celebration. It is a celebration of the inauguration of a very important educational project, and it's in line with, as you know, national priorities and the goals of health promotion and disease prevention nationally, locally, here at Villanova. It is the inspiration of Colonel Bradley McDonald. Brad, we all know you, but I don't know where, there you are, there you're sitting. And Brad saw the opportunity for nurses, nurse practitioners, and dietitians to create a niche via continuing education to improve health through education of health professionals and the community. Interestingly enough, it is exactly 3 years today that this building was dedicated. And so again, on October 6th, it seems to be an important day for us here at Villanova and the College of Nursing. We have another celebration for another important event in our history. The McDonald Center will expand the College of Nursing service to the community, including schools, colleges, corporations, and our own campus, through development and implementation of strategies to improve health through nutrition. And we hope it will better help us to serve our patients and clients and evaluate what works best, what strategies work best, and how we can evaluate what is a good practice and what serves populations, various populations, in dealing with growing health concerns, this in particular. An important idea, I think, is taking life in Driscoll Hall. And we are very, very grateful to the McDonald Family Foundation and the Take Shape for Life Foundation, its directors and officers, but most of all to Brad McDonald himself for providing this extraordinary gift and opportunity for us to move an important agenda forward. Brad, as we all know, as a friend and as a colleague, is an accomplished business executive. But he is also a very loyal Villanovan and a strong advocate of Augustinian values. And Brad, through your generosity, you express our shared mission in many significant ways, and we thank you most sincerely for this contribution. Now, nutrition education has always been a pillar of nursing education, and since the opening of the undergraduate program here at Villanova in 1953, there has always been a faculty member in our college who is not a nurse, but a nutritionist or registered dietitian. The first person, as some of the faculty who were taught by her will remember, was the late Myrtle Fagenberg. She arrived when the school was open and became a legendary faculty member. Someone I had a brief opportunity to know when I first joined Villanova. But for the last 25 years, Dr. Marcia Costello, Marcia, where are you? There, right in front of me, right, has been that person, that non-nurse person, but very important person on the faculty. And she is an extraordinary individual and a teacher scholar. The focus now goes well beyond therapeutic nutrition and finds its home in health promotion. And that is a very important and integral part of the curriculum at all levels and will continue to be. The center staff and advisory committee will be introduced to you by Ann McKenzie a little bit later. But I also thank the high profile and very, very well-credentialed advisory committee, whom you will also meet, for agreeing to assist us with your expertise, your counsel. And in addition to you, our colleagues from across the university, our own faculty, members of the Order of St. Augustine, our staff, clinical agency representatives who are here, a couple of members I know from our College of Nursing Board of Consultants who are here. We are very pleased to have you with us, and particularly pleased, we have a special guest, someone I had not met before today, but is a colleague of Denice Ferko-Adams, who will direct the center, and that is Sylvia Escott-Stump. And Sylvia is the president of the American Dietetics Association, and so we welcome you to Villanova and to the college, Sylvia. Directing the new center is Denice. You will meet her under the administrative oversight of Lynn Desilets, our assistant dean for continuing education, Peggy Lyons, who is a nurse practitioner and a program coordinator, and Louisa Zullo, who has worked with us in CE for many years and is indispensable, a member of our staff. So we thank you all, our colleagues, for joining us this afternoon. And after the program, please remain for a reception, which is specifically in honor of Colonel McDonald, who has shared his success with us by furthering this important health concern through the College of Nursing, so that we can better extend our reach through focused and critical health education. Again, Brad, thank you so much for your confidence in us, for your investment in Villanova and the College of Nursing in particular. It's exciting work, and we are very, very grateful to you, to the foundations, to your family, to your colleagues. And we look forward to working with you closely as we move forward. So thank you again. I would like to call upon Father Cale Ellis, who's our Chief Academic Officer, also called Academic Vice President, who will bring greetings from the university.
Thank you very much, Louise. As I was at the desk there getting the information, I was looking for the registration form to sign up for, and they said that's coming later, and Ann assured me, and so did Denice, the new director. But good afternoon, and it gives me great pleasure to greet you on behalf of Villanova University to the inauguration of the McDonald Center for Obesity Prevention and Education, or COPE. I thought that was a nice acronym, COPE. And also, I'd like to extend my congratulations to Brad McDonald, a proud Villanova graduate, for initiating the discussion on the center and for housing it in our very highly regarded College of Nursing, and to Dean Louise Fitzpatrick and her faculty and staff for agreeing to take it on and build on this important initiative. The formation of the center could not be more timely, I believe. Recently, we were treated to a discussion of the suitability of a certain governor to run for the presidency based on his weight, not necessarily on his qualifications and experience. But despite the growing prevalence of obesity in this country, it is often seen as revolting, and because it is perceived as something that's changeable, people who suffer from it are sometimes demonized. As Frank Bruni, who is a reporter for the New York Times, wrote recently, he says that when I listen to people talk around me, I detect more sympathy for smokers or alcoholics than for overeaters, though the latter are in the grip of a similarly compulsive and perhaps addictive behavior, and that is one that is even harder to control. So we read the statistics. I was looking at the nursing website, 2 out of 3 adults, but I understand it's more now. It keeps growing by the minute, so to speak. In terms of children, there was one statistic, 1 out of 3 children, but that is apparently growing, who is either overweight or obese. And that means basically that we are teaching our unhealthy habits to our children, and the epidemic therefore will carry on for generations to come. And so, yet we know that there are several factors involved in obesity, such as heredity and environment. But whatever the cause, we also know that excess weight endangers health and potentially exacerbates other ailments, such as asthma, diabetes, heart disease, stroke. The list goes on. And also, more importantly, and more startlingly, a shortened lifespan as well. And so that is why I think COPE, the center, is so important, and that we are grateful to Brad McDonald for addressing this issue and sponsoring this Center for Obesity Prevention and Education at Villanova University. And we want to thank you, Brad, and thank you, Louise, and thanks to all the people who support you for making this service to our community possible. And I cannot think of any other center that has a concern for the health of the community that better reflects our Augustinian heritage. So, again, thank you.
Good afternoon. I'm Ann McKenzie, and I'm our Coordinator of College Relations here at the College of Nursing. And I'm very pleased to introduce to you today Father Mickey, as everyone knows him, Reverend Anthony Genovese, who's here to offer our invocation.
I'm glad I'm praying. Following the dean and the vice president, I'm glad I'm in the praying mode here. Let us pray. Lord our God, through the power of the Holy Spirit, your Son healed our infirmities and diseases. When he sent forth his disciples to preach the gospel, he commanded them to visit and heal the sick. Lord God Almighty, in your kindness, hear our prayers this afternoon. We dedicate this McDonald Center for Obesity Prevention and Education to the progress of the sciences and to learning. Make it become a center where students and teachers will learn for the wisdom that guides them to provide their brothers and sisters to live a healthier life. Help those who participate in the work of the McDonald Center for Obesity Prevention and Education to be aware that whenever we look to the well-being of our neighbor or the community and serve them, we are, in a sense, God's own co-workers. Let us pray for God's help through this celebration this afternoon, my brothers and sisters, that God will bring to successful completion the work that he continues here. Bless Brad and Shirley McDonald, their children and their families, for sharing their time, talent, and treasure. Especially that this here at Driscoll Hall, which is the home of the nursing, School of Nursing here at Villanova University. May their kindness be rewarded many times over. We ask these prayers through Christ our Lord. St. Thomas of Villanova, pray for us.
Thank you, Father. Father Mickey is our prior provincial of the province of St. Thomas of Villanova. We're pleased to have with us today members of our COPE Advisory Committee, and I would like to take a moment to introduce them. First is our chairperson, who you saw her hand at least briefly, Dr. Marcia Costello, who's a registered dietitian, also an assistant professor here in the College of Nursing. Dr. Elizabeth Blunt, assistant professor in the College of Nursing and also coordinator of our nurse practitioner programs. Dr. Lawrence Cheskin, who's a well-known scholar and clinician in weight management, who is founder and director of the Johns Hopkins Weight Management Center and also associate professor of health, behavior, and society at the Johns Hopkins Bloomberg School of Public Health. Dr. Lisa Davis, Vice President of Scientific and Clinical Affairs, and also Corporate Medical Officer for Medifast. Mrs. Denise Devine, a member of the Villanova University Board of Trustees and CEO and President of NutraPharm. Ms. Gail Gamble, who is chef nutritionist for Villanova University Dining Services. Dr. Lisa Gottschall, who's Director of Clinical Research, Medifast Incorporated Scientific and Clinical Affairs. Dr. Leslie Perry, who sits ex officio on the committee. She is our Associate Dean here in the College of Nursing. And Father Donald Riley, who is immediate past prior provincial of the province of St. Thomas of Villanova and is currently president of St. Augustine Prep in New Jersey. And you have a sense of the COPE staff from Dean Fitzpatrick's remarks, but I'd like to officially introduce the members of the staff. First, from our continuing education program in which the center is housed, Dr. Lenore Desolitz, who has administrative oversight of COPE. And she is the Assistant Dean and Director of our continuing education program. Peggy Lyons, who is a nurse with us and is our CE program coordinator. And the indispensable Louisa Zullo, who is our program assistant in CE. And someone who's new to our campus and our college, but it feels like we've known her forever already because she fit right in, our center's director, Denice Ferko-Adams. Denice is a registered dietitian and a licensed nutritionist with a master's degree in public health, who brings more than 20 years of clinical, community, and worksite experience to her role. She is a national expert and a leader in the American Dietetic Association, receiving the 2009 ADA Excellence in Practice Award in Business and Consultation. This was for recognition of her pioneering efforts in worksite wellness. As president of her own consulting company, she promoted health with such clients as Lockheed Martin, BMW, Harley-Davidson, and Lehigh University, certainly a diverse group. Denice will say a few words about COPE, and then we'll also introduce our guest speaker.
Thank you, Anne, for that wonderful introduction. Can everyone hear me? Great. Well, welcome. I'd like to welcome our colleagues, staff, faculty, and students, as well as our invited guests, to the first center in a School of Nursing in the nation for a Center for Obesity Prevention and Education. If you can feel the excitement in the air, it is because it truly is a historic moment for Villanova and for the College of Nursing. And I just learned today about the coincidence of that day. So we should all be playing that number before 7 o'clock today. After 4 months of working in the College of Nursing, it is really an honor to serve in this role as director. And I am probably the most thankful for the generosity of the McDonald Family Foundation and the Take Shape for Life Foundation for supporting this effort. If I compare the building of the center to building a home, the blueprint was done months ago, and the foundation has been poured and set. Our COPE team has rolled up their sleeve, and they've been hard at work building the framework to make a dream center a reality. Now I will briefly cover the framework, which is the mission and the objectives, and then introduce our keynote speaker. The mission is to serve as a model for education and research that promotes healthy weight management and the prevention and reduction of obesity-related diseases across the life cycle. We know that being overweight or obese, as you've heard, increases your risk of diabetes, heart disease, and high blood pressure, and many other conditions that decrease the quality and length of life. But what consumers aren't hearing is making very modest lifestyle changes, and just losing a few pounds can help reverse those conditions. Villanova's College of Nursing already has an exemplary program, and the center will keep it in the forefront of the profession. The 4 objectives: the first one, to provide continuing education. It is a great fit that this is where it is housed in the College of Nursing. We will provide continuing education both for health professionals on weight management and disease-related topics. If you did not pick up a save the date flyer, we already have a date for you to hold, which is March 31st, where we will hold our first annual conference, and the title is Weight Management, Conversation to Commitment, What You Say Matters. And it will address the current need for health professionals to initiate the conversation with their patients on how to improve their weight and lifestyle. In addition, we will be offering webinars for health professionals and consumers online by December, so make sure you check our website. I'm sorry. The second goal, partner with agencies and organizations. We are not interested in duplicating services that already exist in the community. Rather, we want to be a resource for them. We want to provide training programs and showcase best practice programs for populations that are significantly impacted by health disparities. Our third goal, to enhance education of the nursing students and all students within the university in weight management and obesity prevention. For example, the College of Nursing, as many of you know, has a well-established simulation lab where students practice clinical skills, and we are working with them to develop scenarios around child, teen, and adult obesity. And last but not least, participate in research. We are exploring grants that will also address this need for child, teen, and adult obesity in the community and in work sites. My COPE team is very excited to finish the framework and begin the next steps of service development and delivery, and I encourage you to check our website, and that we have this great URL, villanova.edu/COPE, to see our upcoming blog, and you'll find us on Facebook, and be looking for those webinars. And at this time, I have the pleasure of introducing my colleague, Sylvia Escott-Stump. Sylvia is a licensed nutritionist and registered dietitian from Greenville, North Carolina, and is a dietetic program director in the Department of Nutrition Science at East Carolina University. Originally from Wellsboro, Pennsylvania, Sylvia is a dietetics graduate of Indiana University of Pennsylvania, where she also earned a master's degree in adult and community education, and it is also where I had graduated as well. Sylvia is an internationally known speaker and consultant to physician groups, long-term care facilities, businesses, and educational organizations. Her areas of expertise include cultural competency, elderly nutrition, functional foods, phytochemicals, nutritional assessment, and nutrition and genetics. She is the American Dietetics Association 86th president and chairs the ADA Board of Directors, which has responsibility for strategic planning, policy development, and fiscal management for our 72,000 members. Sylvia's leadership in the ADA is paralleled by her scholarly contribution as an author of numerous articles, 7 editions of the Nutrition and Diagnosis-Related Care, and 5 editions of Krause's Food and Nutrition Therapy, a required text for many college nutrition programs. She has been recognized with many awards, including the ADA's Medallion Award and the Margene Wagstaff Fellowship for Innovation in Dietetics Education in 2007. Sylvia is a mentor, she is a friend, and she is an inspiration to those in our profession. Please help me welcome Sylvia Escott-Stump.
Thank you very much. Can you hear me? Can you hear me now, right? Okay. Well, thank you, Denise, and thank you all for inviting me to come. It's always a pleasure to come home to Pennsylvania. I miss it, and actually October is my favorite time of year, so thank you for letting me come and look at your leaves. Ours don't come until late in November, so. But it is a pleasure to be here, and certainly to talk a little bit about the dietetic profession and what we're doing, but also just to share in your excitement for what you're doing, which is very innovative. We do have 72,000 members, as Denise mentioned to you, and we have a wonderful website, eatright.org, and I will remind you, if you have never thought about it, that the first dietitians were nurses, years ago. Our profession has been around since 1917, and we actually are changing our name after almost 100 years. We will become the Academy of Nutrition and Dietetics, and if you can anticipate that people don't necessarily go to the web for nutrition information by going to dietetics, you'd be correct. They don't typically go there. They go to nutrition. Nutrition is a word that rings with the public more commonly. So we're hoping to teach the public that it's not only the therapeutic end of things, but also the wellness end, and help them realize that they can do things every day, 3 times a day or more, or less, appropriately by thinking of nutrition. So when you think about obesity, can we have our cake and eat it too? Obviously, there are many barriers and causes of obesity. There's no one right way to eat, no one right way to live, but there are many things that we have to consider, and that's what Denice and her center will be looking at individually, helping people identify the factors that have led to the problem. And we're certainly genetically programmed to store fat. If you look at the origin of man and where we used to walk, we don't do that anymore. If you were to consider the Michael Phelps dietary intake, it's about 6,000 calories a day, and when we just walked all over the country or the world, we certainly consumed about that many calories, and we didn't have an obesity problem. So for many of us, it is simply an evolution of sitting more, lifestyle is different, etc. So we have to think about that. So we are programmed to pack on those calories in case we have a hunger strike or something. If we're going to be at in the Arctic for any period of time and not have access to food. So the body is very protective. Inactivity in the modern lifestyle. I know this is Barbie. Barbie has seen better days, I think. And our lifestyles, we no longer live on farms. I know my parents grew up on dairy farms in northern Pennsylvania and, of course, had very active lifestyles. I think probably both my grandparents did fine until they no longer were as active, and one had massive coronaries, the other had stroke. So when you think about just keeping that cardiac muscle going requires a lot of activity. So we have a lot of internet, computer time, TV time. Chores are not as physically demanding. I know it's easy to walk to the dishwasher, put things in. You're not standing for any length of time to get those clean. So just thinking about the day-to-day chores that we have, many fewer calories are being burned. Physical activity in general. Again, we're spending more time in front of the computers than we ever did in the past. When I moved from Pennsylvania to North Carolina, my children were in 3rd and 8th grade, and it was amazing to me. My best friend from high school taught phys ed. She just retired from that. And I told her, I said, Karen, I can't believe it. When you get to 10th grade, all you have to do is run a mile 4 times that year, and you don't have to take any more phys ed. So, 10th, 11th, 12th grade, there's programming of no physical activity. And I remember learning how to play soccer and, tennis and things that I never would have gotten just from my family by phys ed. And so by taking phys ed out of the schools in some states, our state in particular has among the highest obesity in the nation. Pitt County, North Carolina, where I live, has the highest premature cardiovascular mortality in the nation. We're considered the buckle of the stroke belt. So when you think about all those factors, and I looked at my children's experiences in school, the other thing that happened, my daughter when she was in 4th grade, I remember the teacher was probably on her way to retirement, and she wasn't, was a little weary perhaps, but she would punish the whole class if somebody acted out. None of them could go out for recess. So my daughter in 4th grade went outside for recess 4 times. That is not enough, is it? Children eat better. With exercise, in other words, if you have recess before lunch, they eat a better school lunch. So we have lots of data to show us how important activity is to good health and good eating. So we need a combination of parents, community members, teachers, COPE centers, working together to help teachers and parents realize what they need to do differently. I'm always amazed when I see normal weight adults with a very obese child and think, oh, if you could just stop and think about what that means. You're really setting your child up maybe not to outlive you. It just really shocks me, and I just want to say, please, please do something now and make that, get more active as a family. Whatever you can do it differently. Don't think of that as loving your child more so. You're actually setting your child up for health concerns. Fear of outside play in the urban areas, certainly not where I grew up. We played outside until dark, and it was very, very much an enjoyment. But there are many places in urban areas, of course, where children are afraid to go outside and play. It's really not safe for them to do that, so we have to be aware of that and perhaps set up after-school activities, etc. Increased stress, the fact that we're just living a more stressful life, especially I think for children. I think today's children are much more anxious, more pressure on them to behave and perform and do other things than when we were growing up. poor choices, of course, would be very, very important. Again, where I live in Greenville, North Carolina, we have the highest per capita intake per day of fast food in the nation. But we also have very high rates of single-parent households and trying to make a dollar stretch to feed a hungry family. So thinking about those factors, poverty often leads to obesity for a variety of reasons. One thing that I guess when I think about World War I and setting up the sugar and flour and fat being less expensive for the food manufacturers to feed Americans, we don't really need that anymore, do we? So we don't have the wonderful, supports for produce that you can get in other countries. So our produce is expensive. It's expensive to eat healthy, isn't it? So if you're a poor family and you're trying to feed and stretch that dollar, you've got some pressure on you to try to make a healthy meal and learning about that, the fact that beans could be a choice that somebody could have, et cetera. So there's a lot of things that can be done. People aren't cooking at home. We know that there's an interest in the Food Channel, but are people actually cooking? I don't think so. They're watching the Food Channel, but they're actually not going into the kitchens and practicing. So, we have to get people interested in cooking again, because cooking at home can be, of course, less expensive, more nutritious, fewer additives like salt and fat and things like that we don't need the extra. The grab-and-go foods and the fast food, convenience seems to be the number one consumer desire. I want it to be fast, I want it to taste good, and I want it to be fast. So if we can work with, and we are working with, the fast food outlets to say, what else can you do? And they're working with us to say, okay, we're hearing what you're saying. We're willing to add some more things like the children's meals that now have apple slices, for example. So but our voices have to be heard, don't they? We have to make those choices. When people make the purchase, that's what helps the vendors decide what they're going to do from then on. So we have to help do that as well. Oh, I should have mentioned family meals. Family meals are very important. If you look at the sitting down at least once a day of the whole family together to have a conversation, to eat a meal, not to have fights, et cetera, that's a very important thing to go back to the family meal. So if we can, share those messages with the community about how important that is, that will help children, maybe eat more comfortably, more slowly, rather than, hurrying through a meal to rush off to different activities. So family meals are also very important. We certainly have had collaborations over the years with the Medical Society and Nursing Society and organizations working together with dietitians. We've had different committees together, worked on standardized language. We've finally done that in our profession, and the other profession said it's about time. Okay, so sorry. Nursing had language before we did as our own profession with things like inadequate intake of vitamin A or something like that. So we now have the language in there, and hopefully dietitians are changing their documentation to be more specific to what is the problem they're trying to solve. And it's not like a medical diagnosis. We're not going to be out there diagnosing hypertension or diabetes. That's a doctor's job. But our role would be, okay, excessive carbohydrate intake, what are we going to do about that? That's something that we can manage if it's diet related. And so we're going to be taking and owning those problems, hopefully solving them one-on-one with the individual person. We have worked with the Institute of Medicine's obesity prevention policies for young children and the National Physical Activity Plan. And I'm really sad that we don't have what we had growing up, the activity in school and the competitiveness, and you had to climb the rope, and you had games, you had fun things that you could do, and you could compete, but compete in a physical way and a fun way. I think we need to go back and, again, help the schools start that process, because what you learn in school is often what you do for life. And so having a healthy lifestyle very often begins for those early years. We do have the Dietary Guidelines for Americans that have just come out. Of course, they came out in 2011. We call them 2010. But it is the first guideline that really does talk about we have an unhealthy population. We really do need to look at how we're eating and what we're doing differently. We're also looking at cultural differences. We do have a very culturally diverse group of individuals in this country. You have to think about, sitting down with one lifestyle, my plate isn't going to work for every population. You have to talk through, identify the foods that person eats, et cetera, and help show them what it would look like to be healthy. We do have a Kids Eat Right Foundation. It's a wonderful group where dietitians are working with the schools. They're getting kids more active, and they're talking about good, healthy eating. This seems to be very, very popular. We've probably got about 8,000 dietitians who've signed up to be companions or, champions in the schools where they live and work, which is really good. So anybody can sign up if you want to be a champion and help pass that message along. We have 80,000 contacts with kids so far. Now, another thing we've worked with is the Dairy Council and working with the Fuel Up to Play 60, which is being active 60 minutes a day. That's a message that kids can have as a takeaway, and it's usually a football star. Maybe a local football team player that's popular will go into the schools and talk to kids about, fueling up, getting good food to go out and be able to be active. And so it's really a lot of fun, and kids really respond well to that as well. We have been working with First Lady Michelle Obama on her Let's Move campaign, and they did just hire a dietitian, so we're happy about that, they've got a gal who's been, she's also an attorney, and she's very, very active in hunger and environment. So we're looking at that in terms of what can we do differently to put it together for parents to take home messages that are appropriate. We do have what they call an EAL, the Evidence Analysis Library, where colleagues, individual dietitians will say, I'm willing to sign up, I'm a cardiac expert, I want to look at the literature and pull out what's concise and what's consensus and what's important. So we've got the strong and imperative versus fair or not very relevant guidelines that we come up with. And I use my mother as an example. She just passed away, but in 2000 she had mitral valve replaced. And with that, you could say as a dietitian, well, doesn't everybody with heart failure need a low sodium diet? Don't think so. The surgeon said it's a mechanical problem. It's going to take a mechanical solution. So with that, I would say our heart failure guideline won't say that everybody with heart failure needs a low sodium diet because it's going to be based on the cause. And so our EAL is really trying to say, where is diet making a difference? Where does it not make a difference? Where should you be doing things with an imperative message, and where should you say, we don't know enough yet? And so that's important. We turn to this, I say to my colleagues, if you aren't following the guidelines, are you doing best practice? I don't think so, right? So we want our dietitians to be using best practice, to go to the guidelines and say, what do we know to be true? They've just come out with a new Vegetarian Guideline, which again specifically talks about, are there health benefits? Are there risks? Are there nutrients that are missing if somebody's following a vegetarian diet? Yes, there are. And so we need to make sure that dietitians are counseling in that way as well. We have a number of position papers. Usually it's something where there would be controversy. Years ago I was sitting on that committee and somebody said, don't we need a position paper on whole grains? It's like, that's not very controversial. That's pretty much a message. That's our message, So things that are kind of difficult, maybe, or, a couple of opinions need to be addressed within the paper to say, we have a stance, but here's the science on both sides. Here's what we know. And it's such an evolving science. It's a little over 100 years old. So we really don't have all the answers yet, do we? And especially with genetics. Now that we know, if you look at the literature at Duke University where they fed rats different rat chow with folic acid, B12, betaine and choline in different quantities, and the coats of the rats were different colors as a result. It's like, that's huge, isn't it? So you think about those key nutrients, their effect on DNA. We now know that during pregnancy, a woman's diet impacts that child for life, sets up the genes, the DNA, the permanent alterations or the permanent, good structure for that child's lifetime. And so you can promote good health, or you can preclude good health by diet during pregnancy, and then of course all through a lifetime. So very, very important to look at the role of nutrition and genetics. It's something that is exciting and really making a difference in terms of individualizing. You'd be different than you would be different than you, that kind of thing. So we're kind of saying we're putting the you in unique for nutrition counseling for individuals. So these position papers are very helpful to do that. So what can you do as a community? Basically, you can stay in touch with the news. Today's USA Today talked about the factors that we need to eat slowly to help reduce weight. Again, like I talk about family meals, sitting down, making sure it's maybe close to an hour that you spend together before you rush off in 6 different directions. How many of us really spend an hour? Really, when you think about it. When my children were in school, they had 10 minutes for their lunch. By the time they got their meal and sat down, it was 10 minutes, and they had to rush back to the classroom. That is not enough. If your schools are doing that to the kids, just say, work around it. Find a way, start earlier, go later, whatever it takes. Give children enough time to sit down, have a decent lunch, not be anxious about finishing or not finish their meals, but that kind of thing. We need to eat slowly, 20 minutes or longer, so your brain registers what you've eaten. Lifestyle changes first. That's what your center is going to be looking at, helping nurses and doctors and dietitians think about these different changes that can be administered. The Institute of Medicine came out this year and said these are the factors. Limit how much time that child spends in front of a TV, a computer games, etc. Make sure kids are getting enough exercise, sleep. Sleep is a big factor that we're just now learning how important it is, and healthy food. Fitness every day. The muscle is the largest tissue of the body. We want you to be moderately active about 30 minutes every day, as much as possible. Pedometers, very, very helpful. Anytime you measure what you're doing, keeping your food and exercise records, or keeping a pedometer, counting your steps. We now know that 10,000 steps a day is equivalent to about 4 miles a day of steps. That's what it takes for the National Registry, Weight Registry group. They say, I'm eating about 1,400 calories a day and walking about the equivalent of 4 miles a day. I can do this. And those are the people who are successful. They believe that they can do it, and they then actually do it. And so if we understand that, we can help communicate that to the public. We want to work with coalitions. We want to work with schools and PTAs, healthcare providers. We're all in this together, aren't we? Our places of worship. One of my colleagues does a lot with the churches in our area. Black churches in particular, that's the community focus. And so that's a good place to go talk about, making healthier meals for those celebrations, or, getting more active. Just ways of communicating that and giving examples for people. Restaurants, markets, community gardens, gardening. I just came back from the National Food Policy Conference in Washington, D.C., and what is it now? 2% of Americans know where food comes from or live on farms. I mean, isn't that sad? So, the average household has no clue about, growing their own produce, or how much fun it would be to do this and have food from the garden in their home. So we can get back to some of those basics and help people understand that. Work sites, I know Denice is an expert in that area in terms of helping work sites help people, like eat your lunch and then go for a little walk. There's a walking track, or a safe place to go for a little bit of a break away from the desk. Safe streets and walking paths. From what I've read, it's interesting to me, Greenville, North Carolina also had hardly any sidewalks. Sidewalks are important. Sidewalks also need to have a strip of land between the sidewalk and the highway for people to feel safe. I didn't know that. So if you put your sidewalks right on the highway, people are hesitant. They're afraid they'll be hit if there's an accident, that kind of thing. So there's a lot of things that communities can do to make the environment more health-friendly. Our professional partnerships, we can certainly do our collaborations between the different disciplines, but again, parents, health providers, just interested citizens, grandparents, there's a role for everybody to play. We want to certainly capture and use the energy and interest of Americans in addressing this crisis, because it is a crisis. And this generation of young people will not outlive us if we don't do something about it now, because they're really on the edge of really serious illnesses. So we need to be leaders, right? A leader is one who knows the way, goes the way, and shows the way. John Maxwell. We are the leaders. People in this room, Denice and her team, and the dean, we all have this right mission in our minds, and now we just have to put it into effect. So thank you again for being among the first in the nation for setting this up. We appreciate it. And again, your vision and support. I want to thank you, the College of Nursing, and the foundation. Thank you very much.
Thank you, Sylvia. We have two guests who are not able to be with us today, but they did record remarks earlier. So we'll be hearing from Meg Sheetz, who's president and COO of Medifast, and Dr. Wayne Anderson, who is co-founder and medical director of Take Shape for Life. College of Nursing is delighted to be inaugurating the McDonald Center today. We thank Colonel Brad McDonald, the Executive Chairman of the Board of Medifast, for initiating the funding which has made it a reality. He is a retired U.S. Marine Corps Reserve Colonel, having served 28 years, and is a longtime member of the extended Augustinian community since his days as a student at Bonner High School. Colonel McDonald, a Villanova alumnus, credits his education at Villanova for his success as an executive. He was named the 2006 Entrepreneur of the Year in the Consumer Products category by Ernst & Young for the state of Maryland, and he's Vice Chairman of the Marine Corps Reserve Toys for Tots Foundation. Colonel McDonald demonstrates a deep commitment to his community of faith, the Marine Corps, his extended family, and the community at large. As we all know today, he is dedicated to health and wellness, a shared mission with the College of Nursing. I'm pleased to introduce Colonel McDonald.
Thank you very much. Thank you. Really, thank you. Well, thank you very much. I'm very, very humbled to be here. In fact, I have to pinch myself occasionally because when I went to Bonner, there were 23 sections. The one was smart and 23 were the dumbest, and I was in 19. So I just want to tell you, and I'm not going to tell you who else in this room was in 19 with me. Okay, but there is one here that was in there with me. But I'm not going to tell you who he is, even though I've known him for 52 years. Okay, so we start with that. But really, the reason that I'm so excited about this, in my heart, before I became a Marine, I was an Augustinian. Back when I was in high school, I was really going nowhere, and a priest helped me on my way. And that's why I'm here today. And as a result of that, I joined the Augustinians, and I became part of their family. And that family, their symbol's right up there. And really, when you're a part of that family, it never goes away. And it's amazing that in my high school neighborhood, where I went to Bonner, I have friends to this day. And for example, Mike MacDonald. How many years we've known each other, Mike? 50 something years. And by the way, his son is the CEO of Medifast, and without him, I wouldn't be standing here either. So Mike, I want to thank you for all the job you've done. But my point is that the Augustinians built a community of faith and a community of people, and they built bonds where relationships and friendships were the most important thing. And my journey in life, whether it be in the Marine Corps or whatever I did, the Augustinians were very, very important. Whether they baptized my kids when I was at Camp Lejeune or whatever the case may be. There was always that link there to the Augustinians. And then on top of that, like I said, in the Marine community, that community never left. When I left the Augustinians, I was going to get drafted, so Mike McDevitt and I decided to join the Marine Corps. So we did, and we did it under duress, but we did it. Right here at Villanova, right near the Bryn Mawr Beef Canal. And I think back then, Paul here, Colonel Pugh right there was a good NRTC guy while we were just floating around. So Paul was a legitimate Marine, and he did it voluntarily, we did it involuntarily. But anyhow, eventually we got into it, and lo and behold, I stayed 28 years. So I got to tell you that. And then, of course, there's Mary Hicks here, who I served with, so Mary's a Marine. So the Marine community was another part, because it was a very, very important part of my life. But most importantly, I think what I learned from this whole process was the search that somebody like myself could academically excel, could search for the truth, and do the things that we talk about there, to form a community, seek the truth, and then form a community of love and affection with people that you're really friends with. And, that's what Veritas Unitas Character, I think that's what that means. But whatever the case, in Latin, okay? Just in case for those of you that remember Latin, but anyhow, that's what it means. But anyhow, in my life, I've always done that even in my business. I've never looked at a business, even though I've been involved in a public company. I've really felt that my company is part of an extension of my family. I've never considered it other, even though we're public, and that's very rare. We didn't exercise. I brought in people that shared the culture. So when I looked for a CEO of my company, I looked for somebody who was bright, young, smart, the best in his class, and also somebody who could build on the culture and values. And so what did I do? I picked Mike McDevitt, who worked for Blackstone, who was also the son of one of my oldest friends. And as a result of that, last year, Medifast was considered in the top 5 companies in the United States in growth by Fortune magazine. So that was a good selection. And then I teamed him up with my daughter Meg, who again had the same passion, the same share, the same values. And the other thing we're proud of is, unlike most of the people on Wall Street, we manufacture a lot of our products. And I'm not talking about just the Medifast, but we manufacture. And all the Wall Street people wanted me to get rid of the plant because we can manufacture cheaper other places. That's true. Absolutely true. We said we weren't going to do that. We're committed to USA manufacturing. Today, our company hires 250, 300 blue-collar jobs that if they didn't have those jobs, there'd be no place. They'd be people on the streets of Baltimore, and many of them would be drug users. So, and to this day, I could save a few $1 million closing the factory. But that Augustinian background won't let me do it. So I've been fighting Wall Street for years in that. I should say I fight from behind, and Mike has to do it up on Wall Street, but that's okay, Michael, so that's great. But anyhow, but first of all, the other thing, in the partnership, one of the early partners to teach me about obesity and to teach me about this market was Dr. Larry Cheskin. And Larry's been a friend, and actually, really, I want to give him, he's half the inspiration of this. This idea was both his and mine. So I'm going to make you the co-founder of COPE in the sense, your name's not on it, but that's the fact is that Larry was one of the real intellectuals. He was one of the first people that I met when I first took over the business. He was practicing at the Weight Management Center at Hopkins, and he used all the different modalities, including our modality, which is medically formulated portion-controlled meal replacement therapy. It's a long word, but that particular modality was effective for certain things. But he taught me the broadest range of obesity and what the epidemic was. And so Larry's influence was very much an inspiration, and he did our early clinical studies, and later on he became an advisor to us, and then of course today he's involved with the COPE. But I'm telling you, Larry is one of the top 5 experts in the world in this area, because again, he could have been an Augustinian. He's so intellectual. He never bought into just Medifast. He always had, Brad, this is the way it is. This is the way it is. He was intellectually honest and sincere and academic, and it drove me crazy half the time because I was a Marine. But whatever the case, Larry, I got to thank you, because we wouldn't be here today if it wasn't for Larry Cheskin and, of course, Lisa, his wife. So just real short, I'd just like to introduce all the people from Medifast, because I wouldn't be able to make these donations out of the foundations if it wasn't for their hard work. So all the Medifast folks, please stand up. Mike, you're the leader, the CEO. Please, I'd like to give you a hand. Thank you. Thank you very much. Thank you. And then on the other side of it, you don't realize that in 1999, I was very close to bankruptcy. And I came this far from having to file. It was very close. And I asked for some help. So where do you go to help? You go to help with your friends. I asked Father Riley. We came up here to the Bartlett Business School, and we sat here for a couple of days. We talked about different things, and we developed a business plan, a new business plan. And then we executed that new business plan, and it saved Medifast. And it saved all the jobs, and it saved all the other things. So again, where do you go when you're in trouble? You go back to your Augustinian roots. And I could always depend on that, whether it be Donald or whether it be Father Mickey, who I've known for not 52 years, but 45. So we go back. And of course, Joe, same thing back there. And in fact, I hate to tell you this, Father McCluskey, I used to teach him gym at Staten Island. Remember, I was a gym teacher. When he was in high school, I taught him gym. So I just want you to know that that's another thing. But and then the other thing I got to tell you too, where is Father? I didn't see him around. Okay, well, he must have left. But Father Driscoll taught me in high school, and Father Marcellus taught me typing, if you can believe that. So it goes back a long, long time. But really, the other thing is I want to let you know is that this center is not named after me. I named it after my grandfather, and just to give you a little history, which might be interesting to you, and I'm going to donate some interesting medical materials from around the turn of the century. My grandfather was a contract surgeon for the U.S. Army for the Spanish-American War in Mindanao fighting the Moros. And he was the first one to write authoritative tracts on tropical diseases for the U.S. Army. And he did that, and then after that he went to Cuba. Then later on, in 1914, the president made my grandfather the commanding officer of the Red Cross expedition to support the Germans against the Bolsheviks in Budapest. And in that, it's the first Red Cross expedition outside the United States since the Civil War. And he commanded that unit. And that unit, he developed the first triage system because the casualties were massive. There were thousands and thousands of casualties. And he took, believe it or not, he had a unit of over 200 people, of which 160 were nurses, and the rest were doctors, U.S. doctors, working with Germans against the Bolsheviks. And so they came in, And he experimented with Lister's techniques for combat surgery. He was the first one to do that in the U.S. Army. Then later on, he developed the ambulance system for triage. And later on in World War I, which he later on served in under General Pershing, he developed the ambulance system to get troops off the battlefield in World War I. As a result of that, my grandfather is the only United States soldier ever to receive the Iron Cross from Kaiser Wilhelm in 1915 and the Silver Star for fighting the Germans in 1917. So it's really kind of an interesting, and in fact, they wouldn't send him to World War I because of, so that's who the center is named after, Dr. Charles E. McDonald, to give you a little bit of history. And I wish I knew him, I never knew him. And then unfortunately, he met a nurse and he divorced my father's mother, but I'm not going to get into that part of the story. That's the other part of the history I'll tell you about someday. But anyhow, you can tell there's no secrets in my family. But anyhow, as a result, my father really never graduated from high school. My mother didn't graduate from high school, and as many of them, when I went to Bonner, my uncles were all college graduates, and they were all these because they were the upper end of the family. My father was the little kid, and so as a result of that, my father always said to me, he says, "Son," he says, "your grandfather, my father, was the greatest doctor in the world. He'd tell me all about him and all this stuff, but he wasn't a very good dad." You know, I said, "Okay, but my father made a point of being a good dad, which is a good thing." So that was a good part of that. But anyhow, the Obesity Center, what I'm really excited about this is that since I've been in this industry and been in this business, you know, there is no correlation, and I hate to say this, there's no correlation between the number of dietitians and nutritionists we produce and obesity. There is no correlation between a lot of the things we do. Not to say anybody's at fault. Our system is not producing results in terms of metrics. We're not producing, we spend more money and we get less impact. We're spending more money, less impact. And the reason is, all the things we talk about, lifestyle and all those things, we're not impacting on that. And there's a lot of things related to that. But that's why people like us in Medifast, we get people when they haven't done that. We're at the end of the cycle. And one of the things is preventative health. He says we can't keep paying for people's bad habits. There's got to be some penalties for people when they have bad behavior. There's got to be pluses and minuses. There's got to be a lot of things happen. But one of the things he said that's going to happen as a result of bringing 32 million Americans into the system, whether you agree with Obamacare or not Obamacare, this is not a political statement. It makes no difference. We as Americans want to bring 32 million. We want to take care of everybody. That is a legitimate goal. That's something that I want to do. The question is, how do you do it? And here's the answer. The answer is that, believe it or not, today in America, there is no capacity in medical schools to produce doctors for 32 million more Americans. There is none. And that's the dirty lie in Washington. We're going to bring, when anybody says you're going to get the same health care, but bringing 30 million Americans in, they're lying. It can't be. Okay? The only place to produce medical professionals is in nursing schools. Nursing schools have the capacity in America. So what Andy Harris said to me, he says, "Brad, in 10 years, there'll be no such thing as a primary care doctor. We're going to go back to a military triage system." By the way, he was a Navy doctor in Desert Storm as a reservist. We're going to go to a triage system where there's going to be primary care nurses, and nurses are going to be the key are going to be the keystone of our medical system in the future. And that's what lit the fire when Larry and I were talking. Is that it's not the medical schools, because medical schools are burdened; they have limited capacity. It's the nursing schools that are going to make a big difference in the health of America. And I think that nursing schools offer us the best opportunity. And I think that what we're doing here at Villanova is going to be very, very special. If we can spread this out and get this fire going, we could start a preventative health revolution. We could educate and promote, and nurses can have way more impact. And Larry's recent research at Hopkins, he had one statistic that blew my mind away, and I know it. When a person walks into a doctor's office and they're morbidly obese and they're 200 pounds overweight or 100 pounds over or 75 pounds overweight, 74% of the time, no medical professional says to them, "You're overweight or you have an obesity problem." They just walk them in and say, "Well, you got high blood pressure, you got this." We'll talk about the states of disease state they're in, but they won't talk about, "Hey, why don't you do something about your weight?" Or why don't you, they'll do it about smoking, because everybody's against smoking. But smoking and obesity, those two issues, will resolve about 65% of all health matters in the United States tomorrow. And it will drop health costs. And, you know, the other thing is, as a nation, the whole issue today, and this is, and I know as a Marine, I did the budget battles. I was at headquarters Marine Corps like Paul did and the rest of it. Today, all the discretionary spending in the United States is being squeezed out. That's why Congress is looking for cuts, which are ridiculous, because we have a health care system that's out of whack. Medicare and Medicaid are squeezing everything out. And it's not that it's a bad thing. We don't want to cut Medicare and Medicaid. What you got to do is make it effective. Make it, re-engineer it. You got to redo it. And if we redo it, we can take care of the needs, and we don't have to squeeze everything else out. And that's what I think the COPE has the possibility of doing. The COPE has the possibility of laying the seed work to develop new ideas and new concepts, because our nation is at risk today. And the biggest risk we have is that we're going to go broke trying to put a system together that doesn't work. And what we need to do is, we're great Americans. In World War II, we built ships in days. We did all kinds of things. We are the masters of innovation when we want to be. But we got to stop the fighting and arguing. We got to get people together, and we got to get people that buy the Augustinian ethic that's up there, veritas, unitas, and caritas, put facts on the table, and lay it out there, and put ideas on, and then a couple of these will go, and next thing you know, our country will be in better shape. And that's why I'm doing this. I really believe that, and I believe that Medifast wants to be part of it. We know we're one of 10 tools to use in the obesity crisis. There are a lot of other tools. We accept all the tools in the pharmaceutical industry, in the nutrition industry, all those things. Nobody has a monopoly on this. And the idea about genetic disposition to obesity, we know about that because Dr. Allison at the University of Alabama is one of the leading experts on that particular area. So there's a lot of good stuff here, but it's still the biggest single problem is the fact that we don't do anything about the ones we can change tomorrow. We can do this, and it's education and training and it's ideas. And Blue Cross, and I know now Blue Cross, Care First, which is a Blue Cross arm in Baltimore, we're working with them. They're developing new ideas. Other people are developing new ideas. I think we just got a study in the Department of Defense we're working on with some new ideas. So ideas are everything, and we're hoping that out of this COPE will come some of the most dynamic new ideas to solve this crisis and make our country a better place. Because believe me, the country, this is not about defense. The biggest problem we have is health care. And you're right in the middle of it, and nurses are going to be the key. So I'm with you carrying the flag and want you to win. So thank you very much. I appreciate it.
Thank you, Brad. On behalf of the College of Nursing, thank you for being here with us today. And this concludes our program. We'll be taking a few photos up front, but otherwise, please enjoy the reception.